That is on pharyngitis. Okay, so you must have heard about the pharynx. Okay, who can tell me what is the function of the pharynx? Who will tell me? Zinat? Pharynx का दूसरा नाम क्या है? Zinat, Mukul, Shraddha. Who can tell me? Hello. Zinat?
Yes, ma'am.
You can hear my voice?
Yes, ma'am.
चलो ये बताओ, what is a pharynx? What is the function of a pharynx? बोलो, कुछ याद है? Anatomy, physiology? Okay, so basically pharynx, ठीक है, we call it as a throat. Okay, so pharynx is another name for throat. It is basically the passage that connects from the base of the skull, okay, to the level of the 6th and 7th cervical vertebrae. Okay, so basically pharynx is ये जो हमारी throat है, okay, it is like a passage so that the oxygenated air, okay, the air from the outside, it will go down into our lungs, and then the gaseous exchange will take place. Okay, so some people, they complain of sore throat, you know, when the season changes, or when there is any change in temperature, or any change in pressure, or change in the altitude. So some people will have they will develop some sickness. So the first thing that they develop is the sore throat. Okay, before you get any infection also in your body, if you have a cold or if you have a fever, then you also have sore throat. Okay, so pharyngitis is basically sore throat. Okay, so so pharyngitis is also known as a sore throat. Okay, and sore throat is very common even in children, in adults, or in senior citizens. Okay, and mostly people have at least two or three times of sore throat in a year. That depends on the rate of infection. It depends on the patient's immune system, and also depends upon the environment condition. Okay, if the air is very polluted, then people they tend to have sore throat, they tend to have breathing difficulty. Okay, so sore throat is very, very common, and the other name for sore throat, always remember, it is pharyngitis. Okay, so they are very common among children and teenagers who lack immunity. Okay, so if the immune system of the child, or of the teenager, or of a very young adult is very low, then they are a high risk for getting infection. Okay, it can be a bacterial infection, or it can be viral infection, or it can be fungal infection. Then mostly they are not serious and pass within 3 to 7 days without the need for medical treatment. So sometimes क्या होता है, जब whenever you have a sore throat, ठीक है, so the first initial treatment that you take is not an antibiotic or any medicine, but what you do is you tend to do gargle with salt water, or you gargle with betadine wash, or you drink lots of warm water. Okay, and you can gargle with saline water also. Okay, so by doing these things, what happens is the sore throat decreases. Okay, and also what happens is when you have a sore throat, your voice change, है ना? सबने ये I think everyone must have witnessed this. Okay, whenever you have a sore throat, your voice changes. Okay, you're not able to speak properly. Okay, and you have difficulty in swallowing. Okay, when you are drinking water or when you're eating your food, okay, you have a difficulty in swallowing. You have dysphagia. Okay, then okay, so you do not need any medicine for sore throat. Okay, only if it is in a very severe condition. Okay, and apart from sore throat, you are having fever, you are having body ache. Okay, so then these are some of the initial sign and symptom for common cold. Okay, so the first, whenever you try to get a common cold, the first sign and symptom is a sore throat. Okay, I think everyone has observed this in their life. हाँ या ना बोलो.
Yes, ma'am.
हाँ ठीक है. So who can tell me? Okay, let me ask Mukul. Mukul है? Mukul, are you there? मुकुल.
Yes, ma'am.
मुकुल. बोलो. कभी हुआ है sore throat? Have you ever had a sore throat? हुआ है? क्या क्या बताओ, तुम्हारा एक्सपीरियंस बताओ.
हम सूखा सूखा सा हो जाता है बिल्कुल ही, और कुछ ट्रायल नहीं कर सकते.
And then you have itch. Then you have itching in your throat also, है ना?
Yes, ma'am.
So this sore throat is very common. ठीक है, so in medical term उसको sore throat नहीं बोलते, उसको बोलते हैं pharyngitis. ठीक है, so you remember pharyngitis is also called as sore throat, and this sore throat या pharyngitis, it will go on its own within 3 to 7 days, within 1 week. ठीक है, if you are taking proper management. Okay, and you do not need any antibiotics for sore throat, only if it is a critical condition. Okay, so this was about the introduction of pharyngitis. Now coming to the definition. Okay, so what is a pharyngitis or what is a sore throat? It is the acute inflammation of the pharynx. Okay, pharynx क्या होता है? It is a throat, है ना? It is a passage or the pathway for the air to go inside our lungs. Okay, so if the pharynx or if the throat is inflamed, okay, and it has and there will be infection. It will be bacterial infection or viral infection or fungal infection also. Then such condition we call it as pharyngitis. So pharyngitis is nothing but acute inflammation of the pharynx. A sore throat is normally a symptom of bacterial or viral infection such as common cold. Okay, so when people they have a tendency to get rhinitis or common cold. Okay, याद है rhinitis I taught you. Okay, so common cold or rhinitis, then the first symptom that they have is sore throat. Okay, not fever, not mucus discharge, but the first symptom that they are having is sore throat. Okay, so once you get sore throat, okay, you must identify, you must detect कि okay मुझे sore throat हो रहा है, I think I'm going to get sick, I'm going to get infection. Okay, either I'm going to get a common cold or I'm going to get any other infection in my body. So that is the first, sore throat is the first symptom for to get a common cold. Okay, so remember pharyngitis is nothing but acute inflammation of the pharynx or acute inflammation of the throat. So if our pharynx is inflamed, ठीक है, inflammation हो रहा है throat में, infection हो रहा है, so what happen is you are not able to breathe properly. Okay, so the air that you're breathing also, it will not go down to the lungs properly. Okay, so the pathway ये जो passage है वो obstruct हो रहा है. Okay, because of the infection, because of the mucus secretion, because of the pus collection from the infection. Okay, so that will lead to breathing distress or it will lead to respiratory distress. Okay, so there are two types of pharyngitis. Okay, one is acute and the other is chronic. Okay, so acute pharyngitis is for a short duration of time, and chronic can be for a longer duration. It can take months or it can take years also, depending upon the patient's condition. Okay, so acute pharyngitis, so you can see the picture here also. Okay, so okay, so the throat is infected, it is inflamed. You can see white color also. So this is the pus correction. Okay, so because of the bacterial infection or because of viral infection, there is pus or there is abscess. Okay, so this is nothing but pharyngitis. Okay, is it clear till here? किसी को doubt है? Okay. So the difference between acute pharyngitis and chronic pharyngitis. Okay, so you can see on this on your screen. Okay, so there are some characteristics of acute pharyngitis. So number one, it is of a sudden onset. ठीक है, सो दिस ये जो acute pharyngitis है ये एकदम से डेवलप्ड हो जाते हैं. Okay, it can occur suddenly, it can occur unexpectedly because of any change in environment, because of low immunity, or because of any chemical agent which is in the environment. Okay, or it can be because of the polluted air. Okay, or because of change in temperature or change in altitude. Okay, so it is a sudden onset. It means it occurs unexpectedly. It is for a short duration. It does not. It can take like weeks. It can take 3 weeks or 4 weeks or 5 weeks. Then it may be purulent or ulcerated. So ये जो infection है, okay, so if you are not treating the infection within the required time, so what happens is the infection rate increases more gradually, and then pus collection will be formed. Okay, when there is pus collection, then there can be chances for ulcers formation also. Okay, so there can be ulcers in the throat. Okay, not only pus collection, but there can be ulcers also. So this happens in the acute pharyngitis. Okay, whereas in chronic pharyngitis, okay, so this occurs gradually. Okay, gradually का मतलब है if patient is having acute pharyngitis, okay, and patient is not taking proper treatment. He is not following the doctor's orders. He's not taking antibiotics. He's ignoring the medicines. He's not taking steam. He's not taking gargling. So what happens is the infection rate will increase. Okay, so this happens gradually. So this धीरे धीरे जो infection है वो और it will increase, and then patient will go into chronic pharyngitis. Then number two is it occurs for a long duration. Okay, so just sign and symptoms that patient will have, they will have it for a long time. Okay, it can be months or it can be years. Then it occurs due to persistent inflammation of the fats. So that is why I said that if you're not taking proper treatment, jaldi uska treatment nahi le. But if you're feeling that you're having sore throat, and apart from sore throat, your voice changes, you're not able to drink or swallow food, okay, so you have to go and get the treatment. If you're not taking the proper treatment, then ultimately it will cause infection, more and more infection, and there will be pus collection, and there will be ulcers also, and later you'll have respiratory problems. Okay, so that's why we do not want the patient to go into chronic pharyngitis. Okay, so we have to give proper treatment, and also the patient's family also should be educated. They should be taught that if any sore throat happens, then they should get the treatment urgently. Okay, so this is the difference between acute pharyngitis and chronic pharyngitis. So now coming to the causes. Okay, why do we have sore throat, or why do we have the throat infection? Okay, so because of in case of microorganisms. Okay, so microorganisms can be bacteria, it can be virus, or it can be fungus. So if bacteria is the cause, then there are so many microorganisms. There are so many types of bacteria. Okay, and the most common bacteria that causes pharyngitis can be Corynebacterium bacterium, diphtheria, or it can be Streptococcus. Okay, so Streptococcus bacteria or Corynebacterium bacterium, diphtheria, these are the bacteria that can cause throat infection, or it can cause pharyngitis. Then in case of virus, if virus is the main cause, then in virus also there are many types of virus. Okay, so it can be herpes simplex virus, or it can be adenovirus or influenza virus, cytomegalovirus, and Coxsackie virus. So these are the types of virus that have that can cause pharyngitis. and fungus. So like I said that जो infection है that can be caused not only by bacteria or virus, but also there is a third microorganism, we call it as the fungus. So it can be because of the fungus, and the most common fungi is the Candida albicans. Okay, so because of this Candida albicans, patient can have throat infection or pharyngitis. Okay, is it clear till here? Anybody has any doubts?
No, ma'am.
Okay, so coming to the pathophysiology. Okay, so for instance, we take bacteria. Okay, streptococcus, which is very common. Okay, streptococcal infection. So streptococcus is the main bacteria. So if the bacteria, if this streptococcus bacteria has entered into our body, okay, so what does it do? It will try to invade into the pharynx. It will try to go to the pharynx area. It will try to go to the throat area, and when it enters into the pharynx, so what happens is our antibodies, once the infection is inside, once the antigen is inside our body, okay, and once it reaches the pharynx, तो क्या होगा, हमारी जो antibodies है, they will start acting. Okay, they will do their action. They will, they will sense that, oh, there is an antigen, so we have to go and fight and destroy the antigen. Okay, so our antibody and the antigens, they are fighting against each other. Okay, so there is a reaction. We call it as the antigen antibody reaction. Okay, so when antibodies and antigens are attacking each other, they are, there is a very good action in between them. So at that same time, what happens is histamines and prostaglandins. Okay, so these are being released in our body. Okay, so when histamine and the prostaglandins are being released, then there will be inflammation in the pharynx. Okay, so that is how the pharynx is being inflamed, and gradually it will be infected with this microorganism. Okay, and if you are not treating the infection urgently, or you're not taking the initial steps, then it will lead to pus collection. Okay, so this is the pathophysiology for the pharyngitis. Okay, किसी को डाउट है? किरण?
Yes, ma'am.
Any doubt you have? You have any
No, ma'am.
issue?
No, ma'am.
So now coming to the signs and symptoms. Okay, so I hope everybody must have had sore throat in their life. Okay, so who can tell me what are the signs and symptoms apart from Mukul? उसने तो answer दे दिया. Who can tell me? Kunal or Preet Kaur. Can you hear? Yes, Kunal, tell me what can be the signs and symptoms for pharyngitis?
पेन हो सकता है और डिफिकल्टी swallowing, fever,
अच्छा,
irritability.
only that. Okay, ठीक है. So the signs and symptoms for sore throat. Okay, so first of all, you will have pain. Okay, you will have throat pain. Okay, you will because of the throat pain, you will have difficulty in swallowing. Okay, what do we call difficulty in swallowing? It is called as dysphagia. Okay, so patient will have dysphagia, that is difficulty in swallowing. They will have pain while swallowing. We call it as odinophagia. Okay, then apart from that, patient की जो voice है, it will be changed. Voice changes. Then then you'll have fever because of the infection. Okay, apart from that, the cervical lymph nodes, okay, they will be enlarged, they will be swelling. Okay, that is because of the infection. So the lymph nodes will be swelling. Patient will have cough. Okay, along with sore throat, patient will have cough. It can be dry cough, or it can be expectorant cough, or secretions cough. Okay, and patient will have rhinitis. Rhinitis is basically common cold. Okay, so patient will have mucus discharge coming out from their nose. Sometimes patient can have congestions in their nose. Okay, patient can have headache. And apart from this, because patient is coughing too much, so patient will have chest pain, will have abdominal pain. Okay, and they will have weakness or fatigue. Okay, so these are basically the symptoms, the signs and symptoms for pharyngitis. Okay, so who would like to add some of signs and symptoms? Anybody? Vandana, Do you want to add some more signs and symptoms?
No, ma'am.
Okay. So is this clear till here? Is you could doubt it?
No, ma'am.
Okay, so I'll go to the next slide. So now coming to the diagnostic test. Okay, so first of all, we have to do a history taking. Okay, so we have to ask the patient about their, we have to take the present history, present medical history, their past medical history. We have to ask if they have had any tuberculosis before, or if they're suffering from typhoid or from any disease condition, okay, or from COPD, or any lung infection, upper respiratory tract infection, or lower respiratory tract infection. So all the histories we have to ask. Then the present history, the present surgical history, okay, present past surgical history, all these also we have to ask. Then we have to take the physical examination. Okay, so perform the physical examination head to toe, monitor the vital signs. Okay, uh, check for the respiratory rate, which is more important here. Okay, then what else? Yes, fever. If patient is having fever, then you have to monitor the temperature. You can monitor their blood pressure also and their SpO2 level. Okay, because of the infection in the throat, patient will have respiratory problem. They will have dyspnea. Okay, they will have some respiratory distress. So what happens is, if patient is having respiratory problems, then their SpO2 level will decrease. So we have to monitor the SpO2 also. Okay, then apart from this, there will be throat culture. Okay, so we will take a swab. Okay, so we will from the throat culture swab. We will take a swab from the throat area, and then we will send it for microbiology test. Okay, so by taking the swab, we will identify if there is any microorganism present. Okay, it can be a bacteria, it can be a virus, or it can be fungi. So if we can identify okay, the bacteria which is present in the sample, that is the streptococcus, it is a bacteria. So we can we can start with antibiotics. Okay, so if virus is the cause, then we can start with antiviral medications. If fungus is the cause, then we can start with antifungal medication. So depending upon the type of microorganism that is present in the throat culture swab. Then we will also perform a CBC test. Okay, so CBC test, we will check their hemoglobin, we will check their WBC count. अगर infection है patient को तो WBC count increases. Okay, so whenever the WBC count increases, then always identify that patient can have infection. Then check the hemoglobin, check the platelet count. Okay, then you perform an ELISA test also. Okay, then apart from this, we can perform the nasal swab if patient is having rhinitis. Okay, so these are some of the diagnostic tests that we can perform on the patient so as to detect the pharyngitis. Now coming to the complications. So if we are not treating the pharyngitis, so like I said, that pharyngitis can lead to complications. Okay, so one of the complication here is acute rheumatic fever. Then number 2 is sinusitis, okay, where the sinuses are inflamed and infected. Then otitis media, okay, where the ears are infected. Mastoiditis, that is the mastoid process is being infected, that is behind the ears. And cellulitis. Cellulitis is nothing but inflammation of the skin. Okay, so these are some of the complications of pharyngitis. Okay, why? Because जो bacteria है और virus है और fungi inside in our throat or in the pharynx, okay, so that bacteria can spread to the, it can go up to the nose, it can go up to the nose area and go and infect the sinuses. Then it can go to the ears and infect the middle ears. Okay, so it can lead to otitis media. Then it can go to the mastoid process behind the ears and go and infect the mastoid process. Then it will lead to mastoiditis. Then this infection can spread to different parts of the body also. Okay, so that is why we have to treat the infection as early as possible. Now coming to the medical management. So what is the regimen or what is the treatment we have to follow? Okay, अगर antibiotics हैं, okay, sorry, अगर bacteria is a cause, then we will give antibiotics. Okay, so antibiotics we can give tablet azithromycin, or we can give tablet ceftum, okay, or we can give tablet monocev. These are antibiotics. Then patient is having pain, swallowing. Patient is having pain while swallowing. Patient is having difficulty in swallowing. Patient is having pain while talking. Okay, so pain hoga, so we have to decrease the pain. So we will give analgesic medicines. In analgesics also we can give NSAIDs, non-steroidal anti-inflammatory drugs, जैसे tap Voveron, tap Brufen, ibuprofen. Okay, so these are some medicines that will reduce the pain level. Then third, because there is inflammation in the pharynx, so we have to give some anti-inflammatory agents. Okay, anti-inflammatory agents ये क्या करते हैं, ये inflammation rate को reduce करते हैं. ठीक है, जहाँ पे भी inflammation है उसको reduce करते हैं. So we will give like injection prednisolone, or we can give injection hydrocortisone, or we can give injection betamethasone or betnesol बोलते हैं उसको. Then anti-inflammatory, okay, then we come to the antihistamines. So antihistamines are given for patients who are having allergies. Okay, so they are also called as anti-allergic medicines. So antihistamine we can give like tablet cetirizine or tablet levocetirizine, LCZ. Okay, so इससे क्या होगा, जो allergies है वो decrease हो जाएगा, and then the inflammation also will decrease. Then patient is having cough. Okay, so cough was one of the sign and symptom. So if patient is having any cough, dry cough or expectorant cough, then we can give antitussive. Okay, antitussive agents are those which reduces the mucus secretions. Okay, so they help in relieving the cough. So example of antitussive would be codeine, or it can be syrup Ghrelin, or we can give syrup Honeytus also. These are antitussive. Then we have to encourage the patient to drink lots of warm water. Okay, not cold, but warm water. And if patient is having any rhinitis, common cold, then their nose will be congested. And congestion hoga, it will be there will be some obstruction. Patient will not be able to breathe properly because of the congestion of the mucus secretions. So we should give nasal decongestant like Otrivin nasal drop. Okay, so when we or nasal spray. So when we spray the Otrivin medicine, what happens is the congestions will be reduced. Okay, the mucus secretions will be softened, and then there will be no obstruction. Patient will feel better and he will be able to breathe properly from the nose. Okay, so these are some of the medical management that we can give to the patient depending upon their sign and symptoms. And also if patient is having fever, ठीक है, so fever के लिए हम कौन सी medicines देते हैं? We can give tablet paracetamol. Okay, so we can give tablet paracetamol if patient is having any fever. Okay, so these are some of the medicines that we can administer to the patient. Is this clear with all these points? किसी को doubt है?
No, ma'am.
Now coming to the nursing management. Okay, so what are the roles and responsibilities of the nurse? First of all, you have to monitor their vital signs. Okay, patient is having fever, you have to check their temperature by using thermometer. Then you have to check their respiratory rate. Okay, because patient will have respiratory problem. Patient will not be able to breathe properly from their nose because of the nasal congestion. Okay, and there is inflammation in the throat, so the air passage also is obstructed. Obstruction हो रहा है बीच में. So air is not able to go properly into the lungs. So patient will have this respiratory distress. So we have to monitor the respiratory rate. We have to monitor their SpO2 level, okay, and their blood pressure also, okay, and as well as the pulse rate. Okay, so monitor vital signs is very important. So that is the first nursing responsibility. Number 2, we advise the patient to gargle with warm saline water. Okay, we advise the patient to take warm water and mix. We add salt. Okay, we add salt in the warm water, mix it well, and then tell the patient to gargle. Okay, so we can advise the patient to gargle with salt water, or we can tell the patient to gargle with betadine wash also. Then encourage the patient for hand hygiene. Okay, so if they are coughing, okay, if they are sneezing, mucus discharge is coming out from the nose, then we have to if they have to have handkerchief or they have to have tissues. Okay, so after coughing, then patient should wash their hands so as to prevent any prevent the cross infection. Then tell the patient to drink lots of warm water, warm fluids. Okay, avoid contact with others until the fever decreases. Okay, apart from that, tell the patient to maintain hygiene. Okay, tell the patient to maintain oral hygiene, especially. Then teach the patient about self-care, about grooming. Okay, and also if they are having cough, then tell the patient to use they should have handkerchief, they should have tissues, okay, to cover their nose, to cover their mouth whenever they are sneezing or when they are coughing. So these etiquettes should be taught to the patient. Okay. So is this clear with the nursing responsibility and nursing management? Anybody has any doubt?
No, ma'am.
Okay, so is this clear about the topic for today? किसी को doubt है with pharyngitis? Okay. Okay, so I will send the PowerPoint in the group, and you go through the notes, okay, and if you have any doubts, you let me know, okay, and also send me the screenshot. I would like to see this attendance because they are very less in number, and those who are absent will be absent for the day. कितना 26 students है. Okay, Chandra, you take a screenshot and you send me. I will mark these students present only for today. What's our absence?
Okay.
ठीक है. Okay then. Thank you all.
Thank you, ma'am.
Thank you, ma'am.